Hey, good afternoon, Scurry County. It's Dan Hicks, your county judge. I'm going to give you some information here in just a second. All right, so this morning there was some confusion. Apparently that Snyder Oaks test sent to didn't contact the local health authority, the health department, or my office. They did, however, contact Snyder Oaks sometime yesterday. So the first I knew that there were potentially positive cases at Snyder Oaks was when I checked my email and I had a question from a TV news station. I started to answer that question, but I decided to call the health department emergency management first, and they had just found out about the possibility that there are cases at Snyder Oaks. So Snyder Oaks is great in putting all types of protections for the patients and staff who tested positive and those that tested negative. They've really gone the extra mile since they've gotten the results. And that they started putting those in place as soon as they got the information. As we began getting more information, we found out that most, if not all, that tested positive were asymptomatic, no symptoms at all. The multiple potential positives with so many asymptomatic, it's very good news. But at the same time, it's alarming to me, the health department, and our local health authority. So listening to stories around the state and country, nursing home patients are usually the ones that are hit the hardest. And considering that the information was, the testing was 7 to 8 days old when we got the information, you can see that we would be concerned that there should be more symptoms going along with this. So why weren't our cases, or why weren't ours having symptoms here? So with that decision, with hearing all of that, with the asymptomatic and so many positives possible there, we've decided, by the local health authority decided, that we should retest all of those, and that process began this morning. And I want to say thank you to Bill Dickinson and his staff at the Cogdell Lab for doing the testing today. It was taking a huge undertaking on themselves to get out there and get that done, and that's very much appreciated. So this afternoon, while I was on a call with DSHS, I found out that there are many nursing homes throughout Texas who've received multiple potential positives, with many of these asymptomatic. So it's not just us that was affected here in Scurry County. DSHS is looking into whether there was possible lab error or any other possibilities as to why so many nursing homes that appeared to have no positive COVID-19 cases potentially have high numbers of positives. We're going to stay in continuous contact with DSHS, and as soon as we have more information, we're going to give it to you. Myself, the health unit, and the local health authority, Dr. Cooper, don't feel comfortable adding Snyder Oaks numbers to the count until the retesting is complete. At this time, Scurry County will show the numbers for Snyder Oaks as pending until we get the retesting results in the next 24 to 48 hours. There were no additional positive cases reported today outside of that Snyder Oaks number. As a reminder, I want you to know that direct contact is close contact. It's under 6 feet, and it's for a prolonged period of time. It's 15 minutes or more. So let me give you the numbers for Scurry County right now. Tested has been 847. Pending, and remember we're putting those Snyder Oaks numbers in the pending for now. It's 126. Negative is 688. Total of 33 positives. Recovered is 2, and active cases is 31. In Texas, we've had 1,093,676 tested. Positive 64,880. On that positive on the test, I was looking at the 31st numbers. I think it was 970,000. So you can see just in one day the jump of nearly 100,000 tests. The fatalities is still really low for the state of Texas. It's 1,678. Active cases in Texas is 19,846. 43,338 have recovered, and 231 of 254 counties have reported cases of COVID. So like I said, we're going to continue to follow up on the cases out at Snyder Oaks that we've been told about. I'm doubtful about that because it just doesn't make sense to have that many cases and absolutely no symptoms. So we're going to follow up on it. We'll give you more information as we get it. And with that, y'all have a good afternoon, and we'll talk to you tomorrow.